Well, thank you very much indeed. And hearing those stories of the situation in Yemen and the huge challenges that there are, but also the sterling work that Dr. Adham has highlighted that WHO are doing. And His Excellency indicated the huge efforts that the government are trying to make in order to address the situation. But Dr. Maha has highlighted that there are things that we can do, but we all feel so helpless often a long way away, and we need to think about what we collectively can do to begin to address these issues. I'd like to speak about how we perceive Yemen from the UK, because this increases our understanding of how the UK can engage. And in trying to find out more about this, there is a Foreign and Commonwealth and Development Office situation report that's updated every couple of weeks. And it is clear that in the monitoring of the global COVID situation, there is clear recognition. And I've lifted a paragraph here from the latest, well, from the situation report from the 30th of March, which the Foreign and Commonwealth produces and circulates to a very wide audience. And it highlights that many conflict-affected settings are experiencing a very sort of severe third wave, and it mentions specifically Syria and Yemen undergoing particular challenges. There are then detailed slides which highlight that the problem is also in many neighboring countries, but there's a specific reference here. I mean, these figures are out of date compared to the ones that Dr. Adham shared, with now over 5,000 cases being reported. But he's also highlighted the huge underreporting that exists, that this is a minor representation. But what is key and what has been highlighted in these reports is this 36% increase in the number of reported cases. So there is recognition. But I'm delivering this message at a time when we've just had our Foreign Secretary's announcements of the UK's aid programme. And although the UK aid programme is still a generous one, it's less now with the reduction in the aid budget from 0.7 to 0.5. And that will have implications. And we've already seen a campaign from non-government organisations about the reduction in humanitarian support that these cuts in the aid budget have. And I highlight this because one of our roles as citizens of a country that is committed to supporting international development is to be advocates for that financing support. And that's financing support that has Dr. Adham clearly identified, and Dr. Qassim and Professor Maha has all highlighted, is very much needed. And so we need to ensure that just because every country is facing a financial challenge as a result, that is not a reason to stop providing strategic support to important partners across the world. The next slide really highlights one particular, and the reason I've included this, you don't need to read all the detail, but if these slide sets are circulated afterwards, there are a number of hypertext links within these reports. But the number of the 3 million displaced people in the 200 ID camps were mentioned in the previous presentation. And this is really just to highlight that there have been 3 recently published reports from the International Federation of the Red Cross, the IOM, the International Office on Migration, and UN High Commission on Refugees, all highlighting the particular challenges of pandemics for people who are already vulnerable because they've been displaced as a result of conflict. And these reports highlight that we need to be particularly focused on women and girls, the most vulnerable in society, displaced as a result of conflict, who will be impacted further by the risk of COVID infection. So I think important resources to think about. The next slide, really, again, you won't be able to see all the detail, but it's shared because of the hypertext links. Effectively, the slides will be made available, but they're highlighting that a number of initiatives that the UK government has been committed to. So COVAX has been mentioned, and COVAX is the mechanism for ensuring vaccines are made available, but it is clear that many countries in the world, particularly resource poor countries, are not yet receiving anywhere near the volumes of vaccines that they need. And we've also already heard a description of the challenges, the operational costs of delivering vaccines when they do arrive. So it is not only the absence of vaccines, but also the challenge of delivery that is a particular concern. What I really wanted to focus on, though, is what role can the Faculty of Public Health, for example, play? And the Faculty of Public Health is a membership organisation of public health professionals across the UK and indeed internationally. We have over 400 international members. But also it has special interest groups. There is a Yemen special interest group that connects with the broader community. And I know that there has been a strong link between the Yemen special interest group and the Yemeni diaspora in the UK. And one of the things that we can do together is work on advocacy. So we can advocate against the cuts in, for example, the UK aid budget, which has led to a reduction in humanitarian support. And although the UK aid budget is still a very large budget, these reductions will have a real impact, and it's our collective voices that need to be raised to highlight things that we consider important. We also need to be promoting things like the equitable distribution of vaccines to make sure that all countries, and particularly the poorest and most vulnerable, gain access to this. Now, COVAX has been established for that, but the faculty has recently, with the Academy of Medical Royal Colleges, signed a letter which is saying that the over-ordering of vaccines that the UK has done to protect health in this country, we need to ensure that the excess of those vaccines are distributed to support the global campaign to increase vaccination. And this is in everybody's interest. The world will not be safe until every country has achieved high levels of vaccination against COVID. So it's in everybody's interest. So hopefully we're pushing against a wall, an open door, in order to encourage this. Solidarity has already been mentioned, and I think raising our voices together, publicizing and recognizing the challenges that Yemen is facing, demonstrating that we can work with and support our colleagues, the doctors, nurses, health workers, the people of Yemen who are struggling to deal with the pandemic. That communication and demonstrating the solidarity is important. So we should seek to find whatever means we can to further that. Capacity building. We've already heard about the challenge of health workers, some of whom have not received their salaries. Often they're working in remote situations. It's difficult to get access to learning and development in order to maintain professional standards. And again, members of the faculty have been working to try to identify ways in which we can continue to support our professional colleagues, build these peer-to-peer linkages, which I think are incredibly important. And there has been some initial work to develop a Yemen mobile health app, which would be a communication channel for increasing the flow of information and the exchange for these professional linkages. And these may seem like small things, but for individual health workers who appreciate communication, it can increase people's spirits in the absence of any further and external rewards. And people are working in very difficult circumstances. So trying to find whatever ways we can to provide as much moral support as possible and practical support as possible is important. And the other challenge really is in supporting sort of data collection. We've heard from Dr. Adham that the challenges faced in collecting accurate information, and over the longer term, developing the systems that allow not only information to be collected, but information to be communicated so that we have a clear picture of what is happening in Yemen and can communicate that to the world in order to galvanize support to bring the additional assistance that has been so clearly articulated as needed, will be critically important. So again, it seems like very little, given the huge context, the huge challenges that have been set out. But I think it's only through our collective efforts and our commitments to work together as a global community and work together as health professionals supporting one another, and to work together as a community of the Yemeni population in the UK, showing solidarity overseas and building some of these linkages. And the Faculty of Public Health certainly wants to play an important role in that important collaboration and cooperation. So I will leave it there. Thank you.
Thank you, Prof. Neil. Thank you very much for your input.